There was a newborn across town who was forgetting how to breathe, and the one machine gentle enough to save her was lying dead on a workbench, beaten by 3 senior engineers in 11 straight days. The clock said 72 hours. The company said it couldn't be done. Then a man nobody ever looked at twice, the night janitor in a faded field jacket, stepped over the yellow caution tape at 2 in the morning, sat down beside that machine, and listened to it the way you would listen to a frightened child. By sunrise, it was breathing again. By 9 that same morning, they fired him for touching it. The chief medical officer who signed that termination never knew the truth, and neither did the young CEO who let him do it. The quiet man with the mop had designed that machine himself, building it around a single piece of code he had first written by hand to save one specific baby when she was 3 days old and slipping away. His own daughter. He had come back for one reason only, to make sure it never failed a child the way the world had once almost failed her. Stay with me to the end, because the moment they find out who he really is, everything they built on his silence begins to fall. Elijah's apartment off Cascade Road was the kind of place that told a whole life, without a single framed photograph on the wall. Small, scrubbed clean, arranged cold with a precision that had nothing to do with being poor, and everything to do with a man who had learned to carry only what was necessary. The kitchen counter held exactly 2 plates and 2 cups. The single bookshelf held service manuals and a worn King James Bible, no novels, and tucked into the corner by the closet, pinned with one brass thumbtack, was a square of graph paper folded into quarters, covered in handwriting so fine and deliberate it could not have been anything casual. He never explained that paper to anyone who came by. Almost nobody came by. Naomi was 6 years old and already used to mornings that ran on a schedule. She sat at the kitchen table with a small knitted cap the color of weak tea set beside her orange juice, the way another child might prop up a stuffed animal, except this cap was real, and it had once stretched over a skull no bigger than a plum. She wore it on her wrist most days, faded and loose, because it had been hers before she could remember anything at all. She did not know the whole story of it yet. She only knew her daddy looked at it sometimes the way people look at a door they are afraid to open. "Are you coming home before I'm asleep?" she asked, not looking up from her toast. Elijah set her lunch bag on the counter and weighed the answer the way he weighed most things. "I'll try," he said. That was the answer he gave most often. Not a promise and not a brush-off, just an honest admission that the hours between leaving and coming back held more variables than any man could control. Naomi accepted it with a slow nod and the easy trust of a child who has never once been let down enough to start doubting. He knelt and tied her shoes before the neighbor came to walk her to the bus, pulling the laces to a particular tension, not tight enough to pinch and not loose enough to come undone halfway down the block. For half a second, his mind ran the friction of the knot against the nylon of the lace, the reflex that had run quietly under everything he did for as long as he could remember. Then he stopped himself and looked away, the way a man looks away from a mirror he is not ready to face this early in the day. Before he left, he stood in the doorway, closed his eyes, and said 4 words under his breath, the words his mother had said over every hard thing in her life. "Lord, steady the hands." Then he picked up his keys. If you have ever carried a gift you were not allowed to use, you already understand the particular weight of that morning. Hold on to it. It matters more than it looks like it does. Meridian Medical Systems occupied a glass and limestone campus on the north edge of Atlanta. A building Samuel Hale had grown over 15 years from a rented workshop and a stubborn belief that the machines keeping the smallest patients alive could be made gentler, smarter, and more forgiving than anything on the market. The company was worth $1.5 billion now. It employed 390 people, held 41 patents, and its neonatal ventilator, the Lumen NV2, was running in more than 200 hospitals on 3 continents. Vivian Hale had inherited all of it 18 months ago, 2 weeks after her father's funeral, when she was 29, and still learning what it meant to walk into a room where everyone went quiet and waited for her to speak first. Elijah Carter had been hired onto the night facilities crew 3 months earlier. His application listed 9 years of general maintenance work, 2 references that checked out, and almost nothing else. No engineering degree, No clinical certifications beyond the basic safety cards. He had listed a previous employer as a small contractor in Mechanicsville that had folded years ago, and the facility supervisor flagged the file as thin. The contractor security clearance crossed Dr. Preston Calloway's desk during a routine review, and Calloway signed off on it without a single question. Nobody thought to ask why a chief medical officer would take a personal interest in who pushed a mop at night. He had his reasons. They would surface in time. What no one in the building knew was that Elijah Carter was not using a false name. He was using his own. It simply meant nothing to anyone, because his name had been scrubbed off the very work that had made the company what it was, and the only people left who would recognize it were the man who had erased it and one old technician who had never forgotten. He was assigned to the lower level, the sub-basement, where the older calibration benches lived, where the air handlers ran loudest, and the floor carried a faint tremor whenever the climate chamber cycled overhead. It was the kind of post crews requested transfers away from inside a month. Elijah requested nothing. He showed up, did exactly what the work order said, and spent the quiet hours of his shift walking the perimeter of the engineering floor with his cart, looking at the devices on the benches the way a person looks through an old family album. The day staff took to calling him the quiet one, then just the quiet guy on nights, because he spoke rarely, and when he did it was almost always about a machine and almost never about himself. But now and then, when he thought no one was watching, he would set one palm flat against the casing of a lumen unit and stand there with his eyes closed, for a moment, the way a doctor lays a hand on a chest to feel what no instrument fully translates. It was not concentration that moved through his face in those seconds. It was closer to recognition. One person noticed. Miss Ruth had cleaned the engineering floor at Meridian for 19 years. A churchwoman from the West End who called everyone baby and meant it, and who left a folded paper towel and a peppermint on Elijah's cart most nights without a word. She noticed the way he touched those machines. She never said anything either. Some people know a kindred quiet when they meet it. The crisis announced itself on a Tuesday with the sound of Isaac Brand, Meridian's lead engineer, a 46-year-old with a Georgia Tech doctorate and 20 years in respiratory devices, sitting down very slowly at his bench and saying nothing at all for nearly a full minute. The flagship NV2 unit slated for a critical transport case had failed during pre-deployment validation in a way that did not appear in any service manual at any revision. The fault lived in the pressure recruitment sequence, the part of the firmware that decides, breath by breath, how gently to coax open a newborn's lungs without tearing the fragile tissue. The diagnostic software flagged the failure as impossible given the build, which was its polite way of admitting it had no idea what was wrong. Isaac had spent 4 days on it. 2 consultants flown in from the contract software house had read the logs, murmured to each other in the hallway, and flown home without a fix. The reason the clock mattered had a name, and the name was Rivera. A baby girl had been born at 26 weeks at Grady, 890 grams, and after a hard first month, she had been moved to the cardiac unit at Children's Healthcare of Atlanta, with a combination of immature lungs and a heart defect that no ordinary ventilator could thread the needle around. The NV2 was the one device with a soft enough recruitment curve to keep her oxygenated through the days before her surgery. Hers was the unit on Isaac's bench, and it was dead. Calloway called the meeting on the 4th floor on Thursday afternoon. His voice in those rooms was always the same, smooth, unhurried, carrying a faint undertone of patience with people who could not keep up with him. The options, as he laid them out, were 2. Substitute an older unit and accept the clinical risk, or notify the hospital that Meridian could not deliver and let them find another path. Both cost money. Both cost the reputation the company had spent 15 years building. The only question, he said, was how much of each the board was prepared to absorb. Vivian said neither. She said it simply, without raising her voice, the way her father used to end a discussion. Calloway looked at her a moment longer than necessary, then wrote something in his leather folder and let it go. Elijah heard the whole exchange through the return air grate in the ceiling of the lower level. He was sitting on an overturned milk crate with a paper cup of coffee gone cold in his hands, looking up at nothing. When the voices above went quiet and the chairs scraped back, he stayed where he was a long time. Then he said very softly to no one, "Recruitment sequence, third subroutine. They're all working off the clean build. None of them ever read the original." He set the cup down. He knew exactly what was wrong with that machine, because he was the one who had written what was missing from it. That evening he read to Naomi from a picture book about how the body works. And when they reached the page on lungs, she put her small finger on the pink balloons of the illustration and asked him why some babies forget how to breathe. He went still longer than the question called for. Then he said they don't forget. They just need someone patient enough to teach them slowly. The trick is to never push. Naomi considered this with great seriousness, pulled the faded cap a little higher on her wrist, and was asleep inside for minutes. Elijah sat beside her until her breathing slowed and evened, listening to it the way he listened to everything, then carried the book to the kitchen, turned to the blank end paper at the back, and began to draw. Not slowly, not searching. His hand moved the way a hand moves when it is copying out something already known by heart, lines of logic and a short block of code in a notation only he used, the same notation pinned to the wall by the closet. He worked until the church bells down on Cascade had long gone silent. 6 years ago, a younger man had written that same block of code by a different light, and you cannot understand what Elijah did next without understanding what it cost him to be able to do it at all. Elijah Carter grew up 4 blocks off Ralph David Abernathy Boulevard. In a shotgun house his grandmother kept so clean you could have done surgery on the kitchen floor. His father drove a delivery route and died of a heart attack behind the wheel when Elijah was 11, parked legally on the shoulder of Interstate 20, with the flashers still ticking. His mother, Della, cleaned offices downtown at night and sang alto at Mount Carmel Baptist on Sunday, and she raised her only son on 2 unshakable convictions. The first was that the Lord gives every person a pair of hands and watches closely what they choose to do with them. The second was that a man's worth is decided in the rooms where nobody is watching him. She never had money for the things Elijah took apart and rebuilt, the radios and box fans and the neighbor's lawnmower, so she gave him the only currency she had, which was the steady belief that his mind was a gift and not an accident. He was too poor for the engineering program he got into and too proud to say so out loud, so he taught himself instead. He found a forum, a small, ragged community of self-taught builders, who posted hard control problems for the pleasure of solving them, and within 2 years he was the one the others waited on. He met Grace at a cookout on Cascade when he was 24, a pediatric nurse with a laugh you could find across a crowded room, and they married fast and happy and without a dollar to spare. When Grace got pregnant, they painted a crib yellow in a rented duplex and believed, the way young people do, that the hard part was behind them. Naomi came at 26, 1 pound, 15 ounces. The kind of small that does not look possible. She was placed on one of Meridian's early ventilators in the unit at Grady, and on the worst night, the 3rd night, her oxygen kept sawtoothing down no matter what the staff tried. Because the machine's recruitment curve was too aggressive for lungs the size of 2 postage stamps, and every breath it pushed did a little damage in the act of saving her. Elijah sat in that unit with a borrowed laptop and a service, login a sympathetic respiratory therapist had no business giving him, and he read the firmware until his eyes burned. And he understood it the way he understood everything, all at once and from the inside. He found the routine that decided how hard to push. He rewrote it by hand on a square of graph paper, a gentler sequence that ramped pressure in small patient steps, and backed off the instant the lungs resisted. And the therapist, who had a daughter of her own, loaded it onto the unit at 3 in the morning against every rule in the building. By dawn, Naomi's numbers had stopped sawtoothing. She held, she lived. The graph paper went into Elijah's wallet and never came out. That was the night that changed the direction of his entire life. He had walked into that hospital a self-taught man fixing other people's machines. He walked out of it certain of exactly one thing, that he would spend the rest of his life making sure no parent ever had to gamble their child on a machine that pushed too hard. Word of what he had done traveled the way these things do, therapist to engineer to a friend of a friend, until it reached Samuel Hale, who was building his company on exactly that idea. Hale found Elijah changing a tire in the church lot one Sunday and offered him a job on the spot. And over the next 2.5 years, Elijah Carter quietly designed the heart of what became the Lumen NV2. The soft recruitment curve, the patient ramp, and a quiet safety backstop he added by hand. A piece of logic that caught a rare cascade before it could ever reach a patient. The same instinct that had saved his daughter, written permanently into the machine. He signed every original drawing in the lower corner with 2 initials and a date, the way a man signs a thing he made with his own hands. He meant to formally document the backstop later. Later kept getting away from him. Then Grace died. A drunk driver ran the light at Lee and Gordon on a Wednesday afternoon while Naomi napped in the back seat, and Naomi walked away from it without a scratch, and Grace did not walk away at all. Elijah was 30 and suddenly alone with a 4-year-old in a grief that did not fit through the door of any room. He stopped going into Meridian. He left his drawings on his desk, the originals and the clean copies both, told no one goodbye, and disappeared into the work of simply keeping his daughter alive day to day. The company was in turmoil that season too. Hale's own health was failing. And in the noise of 100 urgent things, nobody looked very hard for the quiet engineer who had stopped coming in. That is the part of the story they will never put in the brochure. 26 weeks, a square of graph paper. A man who built a machine to save the smallest people in the world, and then walked away from it the day the world took the largest thing he had. So why did he come back? Hold that question. The answer is the whole point of everything that follows. He came back because, 2 years later, working a maintenance contract that put him within driving distance of Meridian's surface data, he heard a rumor he could not let go of. A field engineer he still talked to mentioned that a handful of NV2 units in long service had thrown a strange intermittent fault, one nobody could reproduce on the bench, and the description chilled him because he knew that fault. It was the cascade his backstop had been built to catch. He had added that backstop by hand and never written it up, and without it, the units would run clean for years. And then, under exactly the wrong conditions, fail in a way no current engineer would know how to trace, because the current engineers were all building off a clean copy that had never contained it. He could have written a letter. He had written a letter once, and it had gone unanswered. So he did the only thing a man like Elijah Carter knew how to do. He got close enough to fix it himself. He took a job pushing a mop on the night crew, under a thin resume and no claim to anything, and he waited within reach of the machines, ready to be near enough to catch the fault the day it finally caught one of them. He did not come back for credit. He came back to keep his own machine from hurting a baby it had been built to save. Now we are back in the present, at 2 a.m, in a lab Elijah Carter had no clearance to enter. His facilities badge opened the building. He was on the overnight rotation, and the badge did not know the difference between a sub-basement and an engineering floor. The Lumen bench had a strip of yellow tape across the entrance and a printed sign that read, "Authorized Engineering Only." He stepped over the tape without breaking stride. He did not bring unusual tools. He set his standard kit on the floor beside the bench and began from the housing in an order documented nowhere in the current service protocol. Because the current service protocol was 3 revisions removed from the design logic underneath it. He worked from memory, not the uncertain memory of a man trying to recall a procedure, but the memory of the man who wrote it. He connected a service cable, opened the firmware on a cracked tablet he had carried in his cart for 3 months, waiting for exactly this, and navigated to the recruitment sequence. The third subroutine was there in the clean build, smooth and complete, and missing the one thing that mattered. He restored the backstop by hand, line by line, the same logic he had first written on graph paper in a NICU 6 years before, and he set the version flag the way it should have been set all along. Then he ran a full pressure validation on the bench rig, the analog gauge as well as the digital, because he did not trust a screen to tell him a baby was safe when a needle could tell him the truth. At 6:47 in the morning, the NV2 cycled through a clean recruitment sequence and held every target within 0.1%, gentler and steadier than the unit had ever logged in its life. Elijah wiped down the bench, packed his kit, peeled the yellow tape back into place behind him, and went downstairs to finish his shift. Gus Hartwell found him there at 7:15. The old calibration veteran was 60 years old, built like a man who had spent 4 decades lifting things heavier than he should have and would never admit it, and he had a look on his face Elijah had not seen in a long time. The look of a man who has just confirmed something he suspected and cannot decide whether to feel relieved or afraid. Gus did not say a word. He looked at the tablet in Elijah's kit. He looked at Elijah. Then he looked at a yellowed sheet taped inside his own locker door. A small nod passed between them. Gus walked away without speaking. Isaac ran the full validation suite at 7:30 and stood reading the results for a long time. Every pressure target nominal. Recruitment variance lower than the factory specification, lower than the unit had ever recorded in testing. He called 2 of his people over to confirm he was reading the screen right. They confirmed it. Nobody knew what to say. Calloway saw it on the security feed. The timestamp, the access log, the unmistakable figure of the night facilities, tech moving through a restricted bench with the certainty of a man who had been there many times before. He did not go to Vivian that night. He waited until morning, collected the footage, organized the badge records, and built the presentation with care. He left out the validation results. He did not mention that the machine now ran better than it ever had. He sat across from Vivian and said, "We have a serious compliance breach. An unauthorized employee accessed a restricted area and performed undocumented intervention on a life-sustaining device cleared by the FDA, with no clearance of any kind. Have you ever watched someone use a real rule to do a dishonest thing? Watch closely. This is exactly how it is done." Vivian watched the footage. The timestamp read 2:16. The figure on the screen moved through the bench without hesitation, without the tentative quality of a man doing something for the first time. "Is the device functional?" she asked. "That isn't the point," Calloway said. "I'm asking anyway." He squared his folder. "The point is precedent. We are 11 weeks from an FDA inspection. Any undocumented intervention on a cleared device, regardless of outcome, is exactly the kind of finding that puts our whole submission at risk. I don't think you want to be the Hale who learned that lesson the hard way." Vivian was quiet. 18 months ago, she would have deferred to him without a thought. She was still learning when not to, and Calloway was not wrong about the inspection exposure, and she did not yet have enough information to know what she was missing. She signed the termination notice. Elijah came up to the office in his work clothes, an olive field jacket gone soft and pale at the cuffs, clean but carrying the faint smell of solvent that never entirely left him. The jacket had been his father's. He had made a promise standing over his mother's grave, that he would keep his hands in the work and his pride out of it. And the jacket was how he kept the promise where he could feel it. He stood in front of the desk without sitting. His eyes moved across the room once, fast, a habit nearly invisible, and stopped for a fraction of a second, on a framed photograph on the wall to the left. The first Lumen prototype, photographed with Samuel Hale and a knot of grinning early staff. In the lower corner of the original engineering print hanging beside it, almost too small to see from where he stood, were 2 initials and a date in the same fine hand that had filled the back page of Naomi's picture book the night before. Vivian set a tablet on the desk with the footage visible. "Can you explain this?" "I fixed the ventilator," Elijah said. "You weren't authorized to be in that lab. The machine works now. That isn't what I asked you." Calloway stood at Vivian's left, his voice smooth and measured. "Do you understand what that device represents? Do you hold a single certification relevant to that firmware? What exactly qualified you to touch a life-sustaining device scheduled for a critical transport?" Elijah did not look at Calloway. He kept his eyes on Vivian. "Do you want the machine to work this weekend?" he said. "Or do you want the paperwork to be correct?" The question hung in the air. It was not rude and it was not defiant. It was simply the most direct translation of the choice she was being asked to make. And it had exactly one honest answer, and that honest answer would have required her to explain why she was firing him anyway. Vivian looked down at the desk. Calloway laid one hand lightly on the back of her chair. Barely a touch, barely visible, and she looked back up. "I'm sorry, Mr. Carter. Your conduct violated our compliance protocols and the scope of your role. Your employment is terminated effective today." Elijah was quiet for 3 seconds. Then he buttoned the top button of the field jacket slowly, without hurry, and looked at her one last time. "Before you send that unit to Children's this weekend," he said, his voice no louder than a suggestion, "have someone pull the original recruitment firmware. Not the current build. The original spec, the handwritten one, if this company still has it. Compare the third subroutine. That's all." Then he walked out. On his way across the engineering floor, Miss Ruth was emptying a bin by the door. And when one of the day engineers muttered something low about security walking the janitor out, Ruth straightened all the way up, looked the man dead in the eye, and said it loud enough for the whole floor to hear. "That man has more sense in his 2 hands than this entire room has in its head. And one day you'll be sorry you never once asked him his name." Nobody answered her. Elijah paused, met her eyes, and dipped his chin once, the only thank you he had in him just then. Then he was gone. Calloway watched the elevator doors close. His hand, resting on the back of Vivian's chair, pressed down briefly on the fabric before he let it go. 15 floors below, on a quiet bench, behind a strip yellow tape, the NV2 sat ready to breathe for a baby, exactly the way it had been built to breathe. And only 2 people in that whole building knew why. If you were Vivian Hale, what would you have heard in the word original? She heard something. She told herself she was thinking about inspection exposure. She was actually thinking about the particular weight he had put on that one word, the way a person leans on a word that holds more history than the word can carry. He picked Naomi up from the neighbors at 3. She had drawn a picture of a machine made entirely of hearts, and she ran to the door when she heard his key. "You're early," she said, pleased in the way of a child whose expectations have just been exceeded. "I don't have that job anymore," he said. She looked up at him. "Are you sad?" He crouched down to her level, the way he always did when he had something true to say. "No, we'll find something new. Will the new place have machines?" He almost smiled. "Every place has machines." She nodded, satisfied, and went back to her drawing. He made dinner, watched her eat, read to her, and waited until she was asleep with a faded cap on her wrist to pick up his phone and dial a number he had memorized and deleted years ago. Because he memorized things without trying. 3 rings. Then a voice, older, rougher, carrying the weight of a man who had been waiting for this call without ever being sure it would come. "Knew you'd surface eventually," Gus said. "The machine told on you. Ran too clean. Nothing in that building runs that clean unless you're standing next to it." The weekend came. The NV2 was delivered to the cardiac unit at Children's, and baby Rivera was placed on it Saturday morning, and her oxygen numbers stopped their slow, ugly decline and steadied, breath by patient breath for the first time in 2 weeks. The clinical team called it a turnaround. The deployment engineer logged it as nominal. Vivian got the update on her phone Sunday evening and stood at her kitchen window holding it, feeling something she could not name, with one thought running under all the others. A machine nobody currently at Meridian could fully explain had just saved a child, and the only man who could explain it had cleaned out his locker on Friday. Monday morning she went looking for Gus Hartwell. He was at his bench eating a sandwich alone, looking out over the engineering floor with the stillness of a man who has watched the same view for a very long time and is no longer sure whether he is watching it or waiting for something to walk into it. "Did you know who he was?" Vivian asked. No greeting. Gus preferred it that way. He chewed slowly, set the sandwich down on its wrapper. "Knew it his 3rd night here. Maybe his 2nd. Why didn't you tell me?" "Because he didn't want me to. And because that was his to decide, not mine." He looked at her then, the look of a man who has made his peace with a long silence and is now choosing, on purpose, to end it. "But I'll tell you something now, since you came down here and asked, and since it's past the point where it can be taken back." Vivian sat down on a stool. 6 years ago, Gus said, your father hired a kid off the street. No degree. A pregnant wife. A sheet of graph paper. Found him because the kid had hand-written the firmware on one of our early units in the middle of the night to save his own premature daughter. And it worked when nothing the hospital tried had worked. Sam said it was the most elegant control logic he'd ever seen out of anybody, school or no school. He paused. The kid's name was Elijah Carter. In 2.5 years, he designed the entire soft recruitment system. The gentle ramp. The back-off. The backstop. The reason a lumen can hold a 1-pound baby when nothing else on Earth can. That isn't the engineering department's work. no matter whose name ended up on the FDA file. That is his, down to the last line. Vivian's hands were still in her lap. What happened to him? His wife was killed, drunk driver, over on Lee Street. Their little girl was in the car and walked away without a mark. Gus's voice did not soften around the fact. He stated it the way a man states a structural truth, because sentiment would only get in the way of it. He left everything on his desk and walked out. Nobody chased him. Sam was already sick, the place was a mess, and a lot of things got lost that year. And the original firmware? The handwritten spec? On his desk when he left. By the time anyone organized the handover, it was gone. Gus did not say Calloway's name. He did not have to. The direction of it was as clear as a level reading. Vivian sat with that. The lower floor smelled of solder and isopropyl, and the particular staleness of a room where the air handling has never quite kept up. He came back, she said. Not a question. He came back because he was worried about the machine. There's a safety backstop in the original recruitment routine he added by hand and never wrote up. Without it, a unit runs fine for years. Then under the wrong conditions it cascades. No one working off the clean build would ever find it. Gus folded the wrapper around the rest of his lunch with the same care he gave everything. He heard some field units were throwing that fault. So he came back as a janitor. No name anybody would recognize, because somebody made sure of that, no claim. Just close enough to fix it when it finally came up. And this week it came up, on the Rivera unit. Vivian was quiet for a long moment. He wrote to my father. Gus's eyes came up sharp. How do you know that? I don't yet, but you're about to tell me he did. 3 months before Sam passed, a letter came. Sam read it and said he was going to answer it, kept putting it off, because he didn't know how to say what needed saying, and he was running out of strength to say hard things. Something in Gus's face acknowledged a grief Vivian was keeping off her own. He never got to it. Vivian went up to the 3rd floor, to the archive room most of the current staff did not know existed, lined with flat files and Documentenbox, and the paper history of a company that had once been small enough to keep everything in one room. She found the storage unit registered under her father's personal records. The combination was a 6-digit number, her mother's birthday, because Sam Hale had used the same combination for everything, and had never once worried whether that was secure. Inside were contracts, correspondence, and near the bottom of the last drawer, a flat envelope sealed with tape gone amber at the edges. The return address read E. Carter. The postmark was 3 months before her father's death. She opened it, one folded page, the handwriting clear and direct and without a single flourish. I heard you aren't well, and I'm sorry for it. I don't expect you to write back. I don't expect anything. But if Vivian ever needs someone who understands the lumen from the foundation up, I still remember every line of it. There is a backstop in the recruitment routine that isn't in the documentation, and one day a unit is going to need it, and nobody will know to look. I'm not asking for my name on anything. I only want to know the babies are safe. They deserve better than what's happening to the design, and so do the families. E.C. Vivian sat down on the floor of the archive with her back against the shelf and the letter in her hands. Her father had liked to say, when she was young and impatient with detail, that the difference between a good machine and a great one is not in the parts, it is in whether the person who built it was listening when they built it. She had never fully understood that. She was beginning to. She pulled the original handwritten lumen spec from the archive, the set her father had locked away separately, with the fine notations in the lower margin and 2 initials and a date in the corner. She put it beside the current engineering files on the screen. The backstop Gus had described was there in the original and absent from every revision after. The teams who had worked the device for years had all built from a clean copy, and never known there was a deeper document underneath it. Calloway had known. He had known because he was the one who took the original spec off Elijah's desk and submitted the design for FDA clearance with the attribution rewritten as the work of the engineering department in aggregate, under his own digital signature. He had known because he had watched the clean build propagate for years and never corrected it. And he had known the morning a quiet man with a thin resume and a scrubbed name walked into the building exactly who he was looking at. Calloway had not approved that hire to protect anyone. He had approved it to keep Elijah close, visible, and disposable. A facilities tech with no title and no standing could be removed at any convenient moment, on any defensible pretext. And he had engineered exactly that removal, with a compliance argument that was technically valid and morally hollow. The instant Elijah's presence became something harder to manage. What Calloway had not calculated was that Vivian Hale would go looking for something no one had looked for in years. She called him to her office the next afternoon. She did not schedule it through his assistant. She sent the message herself, directly to his phone, and when he arrived, she was standing at the window with her back to him, and 3 things laid out on the desk. He looked at them and did not sit down. The first was the original handwritten lumen spec, the recruitment routine, and the backstop, and the initials in the corner. The second was a chain of internal emails authored by Calloway, attaching the design to the company's FDA submission with the original author removed and the engineering department named in his place, under Calloway's own electronic signature. The third was a square of graph paper, yellowed and soft along its folds, a control routine written in pencil in a fine, deliberate hand, 2 initials and a date. Gus Hartwell had carried it in his wallet for years. In the quiet and total way, certain men hold on to proof of things that should never have been allowed to disappear. The licensing deal with the European group, Vivian said, still facing the window. It's dead. Meridian cannot license the core recruitment system because the authorship was never properly assigned. The actual inventor never signed a transfer, because no one ever presented him with one, because no one ever admitted the original document existed. She turned around. You submitted his work to a federal regulator under a false attribution, and your own signature. That is not a personnel matter anymore. You have 48 hours with counsel before this goes to the board, with every page of it attached. Calloway's voice, when it came, was even. He abandoned the work. He walked out. This company developed it, manufactured it, took it through trials and clearance, and into 200 hospitals. He walked away. He walked away because his wife was killed and he was 30 years old, alone with a 4-year-old. Her voice did not rise. It settled, the way her fathers used to settle when he had finished deciding a thing. And he came back here, asking for nothing, and fixed the machine that was about to fail a child you had already shipped. I'm not having this conversation anymore. Calloway left. He did not say another word. The door closed behind him with the particular silence of a man who has run the numbers on his remaining options and found them insufficient. There would be meetings with attorneys after that. There would be language negotiated and documents reviewed, and a board that had to be walked carefully through, years of a single lie. But the thing that could not be negotiated had already been settled, not by a board or a contract or a termination letter, but by a square of graph paper, a backstop written by hand in a NICU, and a man who had come back simply to keep a machine from hurting a baby it was built to save. Vivian drove out to Cascade Road the next morning. She rang the bell, and the door was opened by a small person in pajamas holding a faded knit cap in one hand. "My daddy's fixing my music box," Naomi said by way of greeting. Through the doorway, Vivian could see Elijah cross-legged on the kitchen floor with the guts of a wind-up music box laid out in front of him in careful order, and a jeweler's screwdriver in his hand. Working with the same complete attention she had seen on the security footage, the same stillness, over a thing that had cost maybe $9. He looked up when he heard her voice. He was not surprised. He set the screwdriver down, told Naomi to play in her room for a few minutes, and stood. They stood in the small kitchen. She put the letter on the table, the one addressed to her father, the one that had never been answered. He looked at it a long time before he picked it up. Then he held it the way a person holds something with weight beyond its paper. "Why didn't you say anything?" she asked. "When I fired you, why didn't you tell me who you were?" "I didn't come here to take anything back," he said. "I came because the machine needed someone who knew its foundation. That's all." "That's all," she repeated, and the words did not quite fit the thing she was feeling. "The Lumen has a failure mode no one on your current team can trace from the documentation they have," he said. "Not because they aren't good, because the documentation is incomplete, and that isn't their fault. Run enough units long enough without the backstop and one of them cascades at exactly the wrong moment. There's a baby at Children's right now named Rivera. There will be others. They are the only reason I came back. Vivian sat down at his table without being invited and without apologizing for it. A moment passed. Calloway took your spec. I know. Did you know that when you came back? He was quiet a moment. I suspected. I didn't come back for Calloway. I came back for the backstop. She looked at him across the table, this careful, quiet man who had sat in her building for 3 months without a title, who had solved a problem that beat 3 engineers and 2 consultants with a few lines of code he had first written 6 years ago, who had been walked out with a form letter, and had said on his way only that she should read the original. And she thought about what it meant to run a company, full of people looking for credit, and how not one of them had been looking at the machine. I'd like you to come back, she said. Not as facilities. She slid a folder across the table. He opened it and read it from the first line to the last with the patience of a man who does not sign anything. He does not fully understand, thorough and unhurried, and she recognized the quality of it because she had watched her father read contracts exactly the same way, as if language like engineering does not forgive imprecision. This clause, he said, the one about my personal history. You decide what's public, not me. I won't be put in front of a camera or a press release or a board without my agreement. Agreed, she said. But I can't take your name off the original drawings. It was always there. It should have always been there. He was quiet a moment. He knew I'd come back, didn't he? Your father. He knew things he didn't have time to explain to me. I'm still finding them. She held his gaze. He kept your spec separate from everything else in his personal archive, behind a lock only family had. He hid it from the man who took it. I think he was keeping it for you. Elijah took the pen from the folder's inner pocket and signed on the line with the same signature that appeared in the lower corner of the original Lumen drawings. The same 2 initials, the same angle, the same quiet certainty of a man who has known who he is for a long time and has only been waiting for a moment when it was safe to say so out loud. He set the pen down. One condition, not in the contract. She waited. There's a woman who cleans the engineering floor at night. Ruth. The only person in that building who spoke for me. I want her looked after, and not with a gift card. A real role, real pay. She has held that floor together with both hands for 19 years, and nobody has ever once asked her name. He paused, and the clinical team at every hospital running an NV2 gets a full briefing on the recruitment logic. The original logic, not just the service protocol. Push a firmware update with the backstop restored to every unit in the field. The babies on them right now come first. They deserve to know what is keeping them alive. Done, she said, without hesitation. All of it. Naomi came out of her room at exactly the wrong moment and exactly the right one, as she usually did, wearing one sock and holding the faded cap, and asked whether the guest was staying for breakfast. Vivian said she couldn't, and thank you. Naomi appraised her with the frank judgment of a 6-year-old and said, You have a nice voice. You sound like the lady at church. Then she went back to her room. Vivian stood. At the door she paused, because there was one thing left that did not have a clean professional form. I'm sorry, she said, for not asking the right questions when I should have. Elijah considered it with the seriousness he gave everything. You asked them eventually, he said. That counts. Here is the part of the story I think about most, and I want you to sit with it too. He did not come back for his name. He came back for a stranger's baby and a line of code nobody knew he had written. How many people do you know who would do a thing like that with no one watching, expecting nothing in return? That is what dignity actually looks like. It is almost always quiet. It almost never asks for the room. Elijah Carter walked back into Meridian Medical Systems the following Monday, not through the loading dock on the night rotation, but through the main entrance, where the woman at the desk said good morning and used his name correctly, and the badge clipped to his jacket read a title that had been true for 6 years and was only now printed on a card. Chief Design Engineer. Gus Hartwell met him at the engineering floor with 2 cups of coffee and held one out without a word. Elijah took it. Isaac Brand crossed the floor within 2 minutes, already talking, a man who had stayed up all night reading the original spec for the first time. I read all of it. The original recruitment system, cover to cover. I have 19 questions, and the first one is how nobody ever told me this existed. Elijah looked at the genuine hunger of a skilled engineer who has just discovered that the foundation of the thing he thought he understood is deeper and stranger and more elegant than he knew, and felt something settle in his chest that had been unsettled for a very long time. "I have all day," he said. Miss Ruth was given an office on the second floor and a title that took the company's HR department 3 drafts to land on, because there was no existing box for what she actually did, which was hold the place together with kindness. Patient and Family Liaison Director. She cried when they told her, and then she laughed, and then she told Vivian she would take it on one condition, that the company fund a program she had been imagining for 19 years. A fund for the families who slept in NICU chairs and could not afford to take the time off work to do it. Vivian named it the Della Carter Fund without telling Elijah first, after the mother who had cleaned offices at night and raised her son to watch his own hands. When Elijah saw the name on the door, he had to step into the stairwell for a minute, and Ruth, who understood, simply waited for him on the other side of it. The field update went out within the month, the backstop restored to every NV2 in more than 200 hospitals, with a clinical briefing on the original recruitment logic that respiratory therapists from Atlanta to Auckland called the clearest explanation of the device they had ever read. Meridian changed its design documentation policies so that no original engineering record could ever again be replaced by a clean copy without the original preserved and attributed. Calloway resolved his 48 hours quietly, through counsel, and his name came off the company in the same silence with which he had once taken Elijah's off the work. Baby Rivera came off the ventilator in May, 11 weeks after she was supposed to, and went home weighing 6 pounds and 1 ounce. Her mother sent Meridian a photograph of her asleep in a car seat too big for her, and Vivian had it framed and hung on the engineering floor, low on the wall where the people who built the machines would pass it every day. There was no name on the photo. There did not need to be. Elijah came home that evening at 5:30. The first time in weeks the light was still in the sky when he turned his key. Naomi heard the lock and came running from the kitchen with flour on her hands because the neighbor had been teaching her to make biscuits, and she pulled him in to see them, uneven and a little too brown on one side, which she described as perfect. He sat at the table and ate a biscuit and did not think about firmware or board meetings or the next 6 months of his life. He thought about whether they were low on orange juice and whether the faded cap had been washed and whether the music box still needed its mainspring retensioned, which it did. After Naomi's bath, after the reading and the good night and the particular stillness that settled over the apartment when she finally slept, Elijah sat alone at the table with a blank sheet of paper in front of him and did not draw anything technical at all. In his jacket pocket was the letter, the one Sam Hale had meant to answer in person and never gotten the chance to. Gus had pressed a card into his hand at the coffee shop 2 days before. Old company stock, chief design engineer, printed above his name in a hand that had been planning to give it to him face to face. Elijah had not thrown it away and had not framed it. He had put it in the back of the kitchen drawer, under the flashlight batteries and the spare key, where things are kept not because they are decorative, but because they are real. He thought about what his mother used to say over every hard thing, the words he still said in doorways without quite meaning to. Lord, steady the hands. He thought about how for years he had said them and not been sure the steadiness was meant for him. He was beginning to believe it now. On the engineering floor the next morning, Isaac was waiting with his 19 questions, and Gus was waiting with the coffee. And through the tall windows on the 15th floor, Vivian Hale stood and watched the two of them lean over a fresh set of drawings with the posture of people building something together. A message had come in that morning from one of the largest pediatric hospital networks in the country, who had seen the NV2's field performance and wanted to talk about a design partnership at her team's earliest convenience. She typed her reply. We would be glad to. Our design team is being properly re-established. Give us a little time to get oriented. She sent it, set the phone face down, and turned back to the glass. Below her the floor was alive with its ordinary noise, the hiss of a test rig, the high tone of a calibration sweep, the low hum of something being run and corrected and run again. And underneath all of it, if you were standing in exactly the right place, and you were the kind of person who listened not for what was loud, but for what was true. A lumen unit on the bench cycled through a clean and patient breath, gentle and certain, and exactly as it had always been designed to breathe, in the hands, at last, of the man who knew every note of it by heart. So I will leave you with the question this whole story has been circling. We spend so much of our lives deciding what a person is worth by what they are wearing, what they drive, what title sits under their name on a badge. And the most valuable man in that entire building spent 3 months pushing a mop while the people in the corner offices stepped around him without ever once meeting his eyes. Cause and effect always settle the account given enough time. The pride that built itself on another man's work came down. The quiet that asked for nothing was finally seen. That is not luck. That is the way the world balances, when even one person is willing to go looking for the truth. If this story moved you, take 1 second to tap like and subscribe, because the stories about quiet dignity are the ones that get buried and the ones the world needs most. And before you go, answer me one honest question down in the comments. Have you ever watched someone be treated as invisible and stayed silent when you could have spoken up, the way Ruth refused to? Or have you been the invisible one in the room yourself? Tell me your story below. I read every single one, and someone who needs to hear it will read it too.